1 week, they can also deliver the Sinovac vaccines here in the Philippines. An estimated 600,000 doses of Sinovac is expected to deliver. These are all donations from Chinese government.
All right, still no specific date. What did Sinovac say this time around about the FDA not recommending CoronaVac, which is the name of their vaccine, to health workers?
Sinovac GM Helen Yang said that, of course, they respect the policy of the Philippines because each and every country also have their own policies. But then she reiterated the different trials that they conducted in different countries. She specifically mentioned the trial that they made in Brazil. She said that in Brazil, Sinovac focused on healthcare workers that actually are exposed to COVID-19 patients. And since these healthcare workers are exposed to COVID-19 patients, that's the reason why the efficacy rate is only 50.4%. Unlike in other countries like Turkey, where the efficacy rate is more than 90% because they did not focus on healthcare workers.
Right. By now, Marce, we have been talking this week so far about tweaking the vaccine priority list to determine who will be able to receive the 600,000 Sinovac shots. Has the government figured out by this time, it is Wednesday, who will receive these vaccines first instead of healthcare workers? Oh, it looks like we have lost our connection with Ms. We'll try to get that connection fixed. In the meantime, let's move on to other news first. We have the Labor Department offering to deploy thousands of Filipino healthcare workers to Europe in exchange for vaccines. To give us her reaction to this, we have Jocelyn Andamo. She is the Secretary General of Filipino Nurses United, joining us over the phone. Good afternoon, ma'am. First of all, have you heard any developments on this yet from our DOLE officials? And how are the negotiations going so far?
Good afternoon. Sorry, we haven't heard any developments yet. As far as we know, the DOLE said that that statement that the nurses will be allowed to be employed in UK and Germany in exchange of the vaccines, which make us very disgusted and frustrated. As an organization, we believe that nurses have their skills and the capacities and are qualified to work as registered nurses outside the country, specifically UK and Germany. And we hope that the DOLE respects our profession and recognize us as professional nurses. And we see this as two separate issues. We would like to reiterate our stand that the cap in the deployment ban be removed and nurses be allowed to work and live for abroad. And then with regards to the issue of vaccines, we hope that our government will procure the vaccine based on the needs of our country.
All right. House Minority Leader Joseph Paduano said, ma'am, that the plan is beneficial because it leverages our resources. What is your take on this, and how do you feel about human resources really being swapped here in this proposition?
We agree that we are really very, very vital part of the resources of the country. But then, sana we are not considered, we are not treated like barter goods. We should be respected as professionals, and like any other human resource, that we hope that we can be consulted and treated, and we hope that our nurses will really benefit and given the due respect, and they will be employed rightfully, and their rights to just wages and good work conditions will be assured by the government.
Right. With regard to timing, ma'am, is it a bit strange because we right now need more healthcare workers, I would think, in the country. Is the number of nurses on duty around the country taking care of this health crisis enough, in your opinion? Do you have numbers?
Um, based, based on our study, our nurses in the country are enough, but then our problem is that they are not maximized and capped by the government. So many nurses are not in the health service field. So we're saying that this deployment ban is actually not rational or not necessary if only the government is doing its job in maximizing and tapping nurses in the pandemic response. No? Ang problem po, ma'am, is that many nurses leave the nursing profession or the healthcare field because they are not well taken care of. At present, many of our nurses suffer and they get sick without benefits and without adequate support from their management and government healthcare system. So we hope that actually, ma'am, we think that SNU thinks that our nurses are really very willing to serve our country and still be part of this pandemic response. But then many of us are really tired, exhausted, and demoralized because they feel that they are not well taken care of and they are left on their own.
All right. Thank you so much for your time, ma'am. Jocelyn Andamo, Secretary General of the Filipino Nurses United. Thanks for your time today. Here are other COVID-19 stories from across the globe. Pfizer-BioNTech vaccines may be stored in standard pharmacy freezers soon instead of ultra-cold ones. This as the U.S. Food and Drug Administration is set to modify documents related to their emergency use, including the relaxation of storage requirements. AstraZeneca will be delivering less than half of its vaccine commitment to the European Union this second quarter. An EU official told Reuters that the drug maker will only be able to ship 90 million of its promised 180 million doses to the 27-nation bloc. And rapid tests might soon be available on smartphones. French researchers behind the Cordial 1 project say that it can deliver results within 10 minutes anywhere, vis-a-vis hours-long PCR tests in laboratories. So far, the yet-to-be-approved Cordial 1 is 90% accurate based on 300 samples. In other news, the Pork Producers Federation says that government is just wasting time investigating the supposed price manipulation scheme of hog producers. In an interview with the chiefs, ProPork Vice President Nicanor Briones said producers cannot hoard supply to jack up prices, especially with the threat of the ASF. He added that the National Bureau of Investigation should instead go after smugglers.
Yan nung pa sinabi ko nagsasayang lang sila ng oras Dahil siyempre, nasabi ko, nagtuturo lang ng may kasalanan ng ating sekretary.
And Russia has reported the world's first cases of the H5N8 bird flu in humans. Should other countries be concerned? Let's watch this video from Bloomberg Quick Take.
Yeah, so we know this is a highly pathogenic strain of bird flu that's been detected in many countries in Europe and Asia over the past few years. And if confirmed, this would be the first time this particular strain has been known to infect humans. Apparently, the infected people had no symptoms, they obviously had no disease, and the virus isn't reported to be spreading from person to person, which means the people caught it from contact with birds, probably poultry. And Russia reported an outbreak of H5N8 in backyard poultry in an area near Kazakhstan in August last year. Flu has been the virus that public health officials have worried the most about in terms of its potential to cause a pandemic. Like SARS-CoV-2, it's a respiratory virus that spreads easily between people, but it's also way more prone to mutating and swapping genes with other flu viruses, creating new strains that humans may not have any immune protection against. Also, waterfowl and migratory birds are considered to be the natural reservoirs of flu viruses, and these birds migrate long distances. So there's a lot of opportunity for them to disseminate their viruses across wide areas and to infect other animals like pigs and people. Authorities in Russia have said that they're already working on a prototype vaccine, which is very common when new influenza threats are detected. Virologists try to isolate and characterize the new strain, and in Russia they will be trying to share that information with a global flu surveillance network so that centers around the world know how to detect this virus, and there will be intense interest in learning whether the virus is capable of both causing disease in people and being transmitted from person to person.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao. We are One News.